Do you have pain in the front part of your shoulder right here? Then you could have long head bicep tendinopathy. So what happens is the tendon for the long head, the bicep that sits on top right here, runs through a groove called the intertubercular groove, and that goes in and attaches on the rim of our shoulder joint on something that's called the glenoid fossa. So you can have this irritated and it will present as pain in the front part of your shoulder. It may radiate down in the bicep. It can radiate up to the side of the neck, but most commonly it's just localized right in the front part of the shoulder. So I'm going to show you 3 tips that you can do at home to try to reduce the pain and improve your strength and range of motion. So the first thing we're going to do is a stretch. A lot of people think you have to be really aggressive with this, and you really don't. Just a gentle, sustained stretch, kind of a low load, long duration stretch does really well. So I have this cane here, this piece of pipe, and just using this for demonstration, you would take the corner, maybe a door facing or something like that. You're going to bring your hand down low, grab a hold of it here. You're going to feel this stretch in the front part of your shoulder, and then I'm going to kind of turn away. Now the reason I like to hold my hand down low instead of bringing it up high is because I don't want to increase any of this kind of pinching sensation that you're getting or irritation on the tendon where it runs under this what's called subacromial arch. So keeping my hand down low, I'm going to kind of turn away. I feel that stretch on the front part of my shoulder here. I feel that in my bicep. And I'm going to hold that between 30 to 60 seconds. And I repeat that a couple times a day. Again, just kind of be easy with this. You don't have to be super aggressive. Just a light pull and stretch does really well. The next thing that we're going to do is a cross fiber friction massage to try to improve the healing and inflammatory response that we're having in and around this tendon. Now you can use those gua sha type tools or those scraping tools that you get at a lot of the beauty sections and all at the stores, or you can just use your fingers and hands. Either way is fine. The big thing with this is a lot of people use too much lotion or too much emollient. You want to really not have so much gliding of the tool if you're using a tool or your hand across the tissue. It's more, again, causing a friction or that increase tissue binding or tissue movement that you're going to have. So you're going to go right over the area that hurts, and I'm going to take my thumb. I've got a little bit of lotion or maybe no lotion at all, and I'm going to kind of go across because that tendon's running up and down. So I'm going to go across the tendon, and I'm going to just massage that back and forth. I may work up and down a little bit, and I would do that somewhere between anywhere from 1 to 3 minutes and maybe just a couple times a day. But that's a great technique that you can do. Again, you don't have to be super aggressive with that. So the last thing we're going to do is a loading strategy where we need to put that tendon under a load to kind of help with that scar remodeling. And what I'm going to use here is just an exercise band. How strong does the band need to be, or how much resistance do you need to have? You want it to be enough to where when you're at the top trying to complete this exercise that it is a little bit difficult for you to be able to do, but not so difficult to where you're overstraining and causing more irritation. Again, it's also normal for you to have some pain and discomfort while you're performing these exercises. Typically with tendon pathologies, you're not pain-free. You're going to have some of that pain as long as your pain kind of goes back down to a baseline, a lower level, back to kind of where you started within a little while of stopping the exercise. So what I'm going to do here is I'm going to step on this band. Now, the difference or the technique that I like to use with this is going to be when I bring my hand up, I'm going to supinate or bring my hand palm side up when I come up to the top. This tendon's muscle, its main function is not to just flex the elbow and bend it up like this, but it is to supinate or rotate the forearm palm side up. So we're going to incorporate that with this movement. So I've got my hand, I'm holding on to it here. My hand is facing, or my palm is facing to my left side. As I come up, I kind of rotate, and I'm going to hold it at the top. Now, this is what's going to be different also with this exercise versus a traditional curl. I'm going to hold this kind of at the top somewhere between 5 to 10 seconds, and then I'm going to slowly lower it under control, rotating my hand back to my left side. I'm going to repeat that again. So I come up, I rotate palm side up. I'm going to hold it up there, and then I'm going to slowly come back down. Now, I would not repeat this for the traditional 3 sets, 5 sets, etc. of 10 to 15 repetitions because I don't want to irritate the long head bicep tendon too much. So what you're going to do is these static holds are going to kind of take the place of some of that. It's called an isometric hold, and you may only complete 2 sets of maybe 5 repetitions, something in that range. You just kind of have to play with it and see what feels okay to you or feels best to you. But that's what you're going to do is that static hold at the top and then slowly lower it under control. So now we have a stretching technique, we have a soft tissue technique, and then we have a tissue loading technique that we're going to use. I hope these tips help, guys, and thank you so much for watching.